Not for the first time, watching the Prime Minister speak, residential care manager was lost for words. She had just heard Boris Johnson tell MP Angela Rayner, herself an ex-care worker, that care homes were getting monthly testing to the best of my knowledge. The reality, as Hayley, who runs in Merseyside, knows, is somewhat different. We have literally just received a box of swab tests from the Department of Health and Social Care this week, she says. The last one was on June the 11th. Shortly afterwards, kits were withdrawn by the DHSC over safety concerns. Meanwhile, the whole staff team was tested for antibodies last week, and it was frightening to discover some of our team who hadn't had any COVID symptoms may have been infectious. Close quote. Scary. Even before the first UK death from COVID-19 on March the 5th, Hayley was acutely aware of the danger to residents at Sherdley Court, a Gold Standard Award-winning home for adults living with mental health conditions, many elderly. But she describes the experience that followed as like being lost at sea. It was a scary and stressful time for all of us, says Hayley, 57. We didn't know where we were going, and we had no sight of land. The daily government bulletins did nothing to reassure or inform anyone, and appeared to contradict their own advice and scientific advice. We were very disappointed with the ring of steel the government claimed to have thrown around care homes. Close quote. The COVID-19 nightmare reached them in early March. The home had begun stocking up on PPE from January, helped by the local authority, St Helens, and a PPE tsar appointed by their parent charity, Making Space. But they felt completely abandoned by government. The cost of basic items quadrupled in price and delivery times increased, Hayley says. We had stopped wearing uniforms years ago, but we found a supplier of brightly coloured scrubs, so staff clothing could be laundered and stored on site. We purchased Crocs for staff, to keep on site and disinfect after every shift. We changed residents' mealtimes, so everyone wasn't sitting in the dining room at the same time. We introduced twice daily temperature and oxygen level checks, so we could quickly see if someone was developing symptoms. We bought a machine that disinfects the air in a room and kills 99% of viruses and bacteria. 2 weeks before official advice, we locked down the home to non-essential visitors. It was often really difficult for residents to understand that the face on the video call was their beloved family member. Close quote. Months later, in July, the Prime Minister would be asked to apologise for suggesting too many care homes didn't follow procedures. Now, in late March, as Dominic Cummings drove 250 miles to Durham with his wife and child, Sherdley Court got the phone call they had dreaded. A long-term resident, in hospital for a non-COVID-19 related procedure and showing no symptoms, had tested positive on admission. He deteriorated and passed away, Hayley says. We were all devastated. He was with us 11 years, and was loved by everyone. Close quote. 2 weeks later, Hayley went to bed unwell. When I awoke, my temperature was 39 C. My fever didn't break for another 3 weeks, hitting 42 C. Close quote. After 2 weeks barely waking, she worked from home looking like a corpse on Zoom, before getting back to work a month later, only to be rushed to hospital. On April the 6th, One day after Johnson was taken into intensive care, 84-year-old Stan Chandler, another popular resident, developed breathing problems. But we had no capacity to test him, Hayley says. A retired accountant who had developed Alzheimer's, Stan was admitted to hospital, diagnosed with Covid-19, and died alone on April the 10th. Staff were distraught. You feel an enormous sense of guilt that somehow, despite all your precautions, this awful virus still managed to find its way into your service, Hayley says. The next day, the Queen gave her Easter message about light overcoming darkness. She said, "As dark as death can be, particularly for those suffering with grief, light and life are greater." Close quote. The following week, the PM was discharged from hospital and virus deaths hit 10,000. But those in care homes were still not being counted. Stan's daughter Paula, 56, had been unable to be with him as she was shielding with MS and caring for her mum. When they rang me, it was 5 to midnight and very short, she says. It was brutal. The call lasted 26 seconds. They just said, "Your dad, he's gone," and that was it. I was lost for words. I had to let the home know straight away. It was very sad. The cremation was at 8 a.m. and no one was there. I told friends and family to think of him at that time. It was all we could do. When I got the ashes back, that was the first contact I'd had with him since Covid. Close quote. Hayley remembers Stan as a huge personality. Every evening, he'd go around the building checking all the doors and windows were locked securely as he'd done in his job, she says. Stan had a fabulous, scowl sense of humor and would take the mickey out of staff on a daily basis. Close quote. In all, the home lost 3 fabulous residents to Covid-19. Several other residents also got the virus, but we were able to nurse them to recovery. 3 of our staff team, including myself, contracted it and recovered. During this time, she says, the government, promoting care badges, added insult to injury. What social care staff actually needed was effective PPE and appropriate guidance, she says. Failed this week. Scientific Advisory Group for Emergencies experts said ministers failed to act on early advice to protect care home residents from coronavirus. Until April 15, the government's advice to hospitals was that negative tests were not needed before transfers or admissions into care homes. That advice led to over a month during which thousands of hospital patients with Covid-19 symptoms may have been discharged to care homes. Meanwhile, it took until April 28 for deaths in care homes even to be included in the daily national toll of coronavirus mortalities. Now Matt Hancock, who once promised a ring of steel, says care homes will be a place of sanctuary this winter, yesterday announcing £546 million extra money to an infection control fund. Back in Merseyside, now among the worst-hit regions with cases rising by 225%, Hayley feels herself brace again. She is also worried the Prime Minister has warned care home visits may soon be restricted again. Even though it may be the right thing to do, it will be massively detrimental to the mental health of many residents. She adds, "I'm concerned about the possibility of people becoming co-infected with Covid as well as the flu virus. We are physically prepared for a second wave, in that we have PPE, policies and guidance, and we can test for the virus, so long as government doesn't run out of kits again. But as staff on the front line, we are emotionally exhausted, and there doesn't seem to be an end in sight. Our precious NHS is an incredible institution, but I think people tend to forget it's the tip of the iceberg in a functioning society. Social care is the larger, hidden part of the iceberg. Over 20,000 people in care homes died in the first wave, around 1/3 of all coronavirus deaths. It was a Tory MP, Theresa Villiers, who told Parliament, "When an inquiry takes place into the Covid pandemic, I fear that its most painful conclusions will relate to what has happened in care homes." Close quote. Or as Britain steers once more into stormy waters, the nation's care homes fear that far from being a place of sanctuary, they are being once again set adrift, losing sight of land once more.